I've described the cosmetic surgery industry as like the Wild West, but without the sheriffs. It's actually worse than that.
I understand why most women don't come forward. It's really difficult to talk about.
There was dubious practices with Medicare billing.
Tonight, we reveal how the cosmetic surgery industry is abusing the Medicare system. Experts tell us this industry is the worst offender, and it's costing taxpayers a fortune. Registered nurse Justin Nixon used to work in the cosmetic surgery sector. Now he's blowing the whistle on how some in the industry routinely drained money from Medicare, sometimes illegally.
Medicare fraud was one of the major concerns that I had from my time working at the Lanza clinics. We would routinely bill bloods and pathology to the taxpayer, but it didn't actually have a medical purpose.
Is this something that you think is rampant in the industry?
Yes, so my understanding is that these sorts of practices are ubiquitous across the cosmetic space.
For almost 2 years, Justin worked at the scandal-ridden cosmetic surgery clinics run by Dr. Daniel Lanza, who retired in December amid an investigation into his clinics.
There's more risk, so this patient's been warned to the hilt. It was like you didn't like hanging down. If you've got a big hang, we can cut it out. 10 kilos of weight just here. See my muscles? Pushing it up. For all new staff, remember, if somebody rings up, they're not happy, they didn't like the nurse, they didn't like the doctor, there's only one answer. The answer is, hey, did you know that Dr. Lanza cares? He's the most caring.
The videos speak for themselves. But there's one dark secret within Dr. Lanza's clinics that hasn't been exposed. And as you're about to hear, it's a carefully planned scam. I'm going to play you an audio.
For new staff, I'm just going to explain Medicare. Medicare is when we claim directly from the government. So we just do it at the front desk and we get the money given to us directly. Medicare is a direct way of claiming from the government. There is an item number for each tummy tuck, but conditions apply. But the main thing is, besides losing a lot of weight, they had to have had resistant rashes on their lower stomach. If the doctor writes those conditions, I can give the item number. They get about $700 back.
What does that mean?
What's actually going on is this was part of the routine or a shtick that the doctors would do, in which they would prime patients to say that they had these conditions. You've got these rashes, is that correct? Because if it is, you could be entitled to a Medicare discount. And that's sort of the way that it was. And so Lanza would sort of prime the patients to say that they had these conditions when they hadn't at all. The reception staff were given a printout of names and they would have to write referrals from the doctors within the clinics.
So you're saying that the receptionists were writing doctor referral letters?
Yes, this was something that happened a lot.
And was it a lot of money?
Yeah, it was huge, having these dodgy referrals every day.
We sent questions to Dr. Lanza, but he didn't respond. It's illegal to claim cosmetic procedures under Medicare. We've obtained internal messages and photos that show how the rules are easily being broken inside some cosmetic surgery clinics. This image, taken inside one of Lanza's clinics, shows a cheat sheet for staff on how to claim Medicare benefits for a procedure, including the Medicare item numbers they will need to use. What do you think was behind the Medicare charging?
In a word, greed.
I've described the cosmetic industry as like the Wild West. We taxpayers, we are unwittingly paying salaries to the outlaws. Like, that's how bad this is.
Medicare expert Dr. Margaret Foe estimates up to $8 billion is lost each year in Medicare fraud, mistakes, and over-servicing by health practitioners. She sees the waste daily because she runs a company which processes Medicare bills for doctors, hospitals, and corporate medical practices. She says the cosmetic surgery industry has some of the worst offenders for wrongful claims against Medicare.
All of the records that I saw had something billed to Medicare. All of them.
We've spoken to doctors, surgeons and whistleblowers who say the cosmetic surgery industry is obtaining rebates from Medicare for services it is not entitled to claim. What makes this even worse is that patients can be put at risk in the process. As you'll see, cosmetic surgeons are upselling risky body-altering surgeries and claiming Medicare.
Just really mortified that there's this person out there that has caused me this just terrible permanent injury, and it wasn't through negligence. Then what was it?
Janine Keppett's life changed forever in June 2018 when she walked into North East Plastic Surgery in Melbourne. The single mother of two needed breast reduction surgery.
I can't believe that somebody did this to me. I was very active. I liked running and cycling, and I was getting neck and back pain, and I used to have to wear 2 bras to run. And I'd heard from other people that breast reduction's life-changing, and they also explained to me the more procedures that you have, the more of a discount that you get. If you go down X amount of cup sizes, then you can get a Medicare rebate. They also tried to talk me into doing a tummy tuck. There was a lot of, I think the term they used was mummy makeover. You know, you need a mummy makeover. And I did mention that I'd had some inflammation of my labia.
What was said to you about getting a labiaplasty?
Just basically that it was a really minor procedure and that it healed quickly.
Janine didn't have a tummy tuck. She did have a breast surgery and a labiaplasty, which is an operation on female genitalia. So you had both procedures. When did you know something wasn't right?
Pretty much straight away. I realised that I'd had a major amputation. She'd removed my clitoral hood. One of the unfortunate outcomes of this, I've had issues with, yes, toileting because I don't have a labia anymore.
You saw a couple of other plastic surgeons.
Yes.
And what did they say?
I do remember one of the surgeons saying that it was one of the worst injuries of this sort he'd ever seen. Everybody who examined me were all horrified.
It's had more than a physical impact. Medicare expert Dr. Margaret Foe has reviewed Janine's medical records and says it contains blatant misuse too.
Well, under Medicare, cosmetic procedures are not claimable. So Janine's records have a lot of errors on them. The item number that was billed for Janine was a labiaplasty, and she did not meet the requirements of that item number. That item number was for repair of female genital mutilation. And in fact, it was particularly horrendous for Janine because her surgery ended up actually inflicting that precise mutilation on her. The anaesthetist charged her a bit over $2,000 and then bulk billed her as well. So here's the thing, the bulk bill amount was like $300, but that was Janine's $300, not the anaesthetist's $300. But the anaesthetist took it as well.
How's it changed your life physically?
I have no feeling down there, so I've lost all sexual function. Because I have no labia, there's no protection to things like urinary tract infections. I struggle with sleep, I have nightmares. It's affected my relationship with my family, my friends and my children. I'm just not the person I used to be. I'm sad and anxious, and it's just, ruined my life.
Dr. Sageetha Senavaratne operated on Janine. Dr. Patrick Tansley was the assistant surgeon. They told 7:30 they deny they engaged in any wrongdoing. Janine later sued, and as part of the process went to an independent medical panel which found she'd suffered a permanent, significant injury.
I thought to myself, at least now there's proof. At least now that there is a legal determination. We had a settlement, but there was no finding of negligence. It didn't go to court.
Now she wants to warn people about the serious risks she faced. For more than a year, I've been investigating alarming practices in the cosmetic surgery industry. Now we've uncovered rampant Medicare abuse across the sector. The holes in our health system are clear to see. An estimated $8 billion is leaking from Medicare each year by medical professionals across every sector.
There are multiple reports of doctors abusing the $28 billion Medicare system and at times putting patients at risk.
Now there are calls to clean up the waste.
If you're stealing from Medicare, you're a grub. If it's being rorted and thieved, then let's get to the bottom of it. And where there's rorting of the system, obviously we need to crack down on that.
For registered nurse Justin Nixon, the risks of speaking out are huge. But he says the abuse of Medicare needs to be exposed.
As a healthcare worker, you're routinely facing the shortages because there's not enough money to go around. There's often ramping hospital cuts, things like that. But certainly there is a huge pool of money. But the problem is that you have avaricious predators diving into the public purse, and then eventually there's not enough money to go around. And so that's why it matters.